Are you real? I don't know. You just seem a little sus.
Okay, if you have ever been told that you have a retroverted or a tilted uterus, let's clear up what it actually is. So in the usual position, your uterus is pointed slightly towards your body, like that. Okay, so it tips towards your bladder. There are other positions that your uterus also can take. So it can sit more in an axial position where it's more straight up and down, or a retroverted uterus. This is where your uterus is sort of tipping backwards. It's tipping towards your rectum, towards your spine. Now, sometimes people get told they have this retroverted uterus, and if you look online, it can be really scary. It can tell you you're going to be infertile. Let's talk about what having a retroverted uterus actually means. So this phrase simply describes the uterus is tilted towards the spine. It's common, it's usually normal. Most people have no symptoms. They never know about it until maybe they go for an ultrasound scan, and the sonographer says, oh, by the way, you've got a tilted uterus. During your periods, if you have a retroverted uterus, you may notice a bit more backache or discomfort with tampons. And with sex, certain positions can feel uncomfortable, but changing the angle, changing the position, or using lubricants can help. When it comes to fertility, a tilted uterus alone does not cause infertility. The issue that sometimes you can have with a tilted or a retroverted uterus is because it becomes tethered. It means it's retroverted, it's pointing backwards, not because it's the natural position that it's sitting in, but because it's stuck down. And this can happen if you've got conditions like endometriosis or fibroids, or you've got scar tissue in your pelvis from a previous infection. In those situations, it can hold the uterus in a retroverted position, and you can have problems with your fertility because of those conditions, not because of the retroverted uterus. But having the retroverted uterus may suggest there's something else going on. If you then become pregnant and you've got a retroverted uterus, what does that mean? Well, again, it doesn't usually have any effect. Like in this video, some people can notice that it may take longer for their bump to pop out when they're pregnant, but eventually it does. Probably more likely towards the end of the second trimester, when your growing uterus anyway just gets so big that it grows out of the pelvis, and that tilt is no longer noticeable. So, have you ever been told that you have a retroverted uterus? Tell me what it meant for you.